Good afternoon, everyone. Thank you all for joining us today. We're so glad you're here. Before we get started, we wanted to note just a few housekeeping points. To avoid background noise, all participants will be muted for the duration of the webinar. We will be addressing questions at the end of the webinar. If you have any questions as the webinar continues, please enter them into the questions box, which is located on the right-hand side of your screen if viewing from a computer, or at the bottom of your screen if viewing from a phone. If you have any comments or concerns during the webinar, please also enter those into the questions box. We will review and address any immediate needs as they occur. A recording of this webinar will be emailed to each registrant tomorrow. The recording will also be available on our website at www.namimd.org for any individuals that were unable to register. After the webinar today, you will be asked to complete a short survey on the aspects of this webinar that you felt were helpful, could be improved, and what you would like to see in future webinars. We plan to continue hosting educational webinars, and we ask that you please fill out this survey to let us know how NAMI Maryland can best support you during this time. NAMI is also excited to partner with BetterHelp to support our local healthcare workers by providing access to a free month of therapy. BetterHelp is convenient, private, online therapy where you can talk to a licensed professional therapist at any time. If you are a healthcare worker, including mental health and/or substance use provider, be sure to fill out the post-webinar feedback form to receive instructions and your discount code. I'll now hand it over to our moderator.
Hello, everyone, and thank you for joining us. I am Gia Greer McGinnis, a board member at NAMI Maryland, and I will be the moderator for today's webinar. We are pleased you've joined us today for this very important topic. The COVID-19 pandemic has taken its toll on many who have lost friends, family members, and coworkers. Many of us are grieving the loss of normalcy and familiarity. You're here today to learn about ways to move through grief and cope with the loss brought on by the ongoing pandemic. NAMI Maryland supports you in the hard work you do, and we want you to benefit from your time with us this afternoon. Today we are hosting Lauren Ruest, who will include general education and information on the topics of self-care, nutrition, and exercise. While they are all individually important, and how they all work together to promote overall wellness and prevent burnout among healthcare workers. She will also include tips for creating and implementing sustainable habits and lifestyle changes. CEUs are not provided for today's webinar, but a certificate of attendance will be sent to each registered participant tomorrow afternoon. And now I'd love to introduce Lauren. Lauren first became interested in the field of social work after volunteering at a needle exchange program called Prevention Point in Philadelphia. She was accepted in the MSW program at Catholic University of America in Washington, D.C. While completing her degree, she had the opportunity to intern with the Charles County Health Department in the Behavioral Health Program and St. Vincent's Villa, a Catholic Charities residential treatment center for children and adolescents. Lauren worked as a service coordinator for a Shepherd Pratt affiliate crisis housing program while completing her MSW, and this is where she realized that her passion was working with individuals diagnosed with mental illness. After graduation, she applied to work at Shepherd Pratt, an inpatient psychiatric hospital in Baltimore, on the crisis admissions unit. The unit acted as short-term triage for both adolescent and adult patients, allowing Lauren to have exposure to a wide range of diagnoses and patient needs. Due to COVID, the unit shifted from a triage unit to a general psych unit and was renamed the Adult Mood Disorder Unit. Lauren has worked as a social worker within the inpatient level of care for a little over 3 years and has experience working with adults, adolescents, and families who are impacted by mental illness. Thank you for joining us today, Lauren.
Yes, thank you. Hi, everyone. I'm Lauren, and we are going to be talking about prioritizing self-care, nutrition, and exercise as a frontline healthcare worker. Gia obviously just covered my professional background, but I also just want to mention that not only are these topics today of professional interest to me, but I'm also very passionate about these topics in my personal life as well. I do work on an adult mood disorder unit and an inpatient hospital, and the social workers do groups a couple times a week. And I usually at least once a month do groups on these topics, self-care, exercise, nutrition, because they're so important for not only healthcare workers, but also the general population as well. Gia mentioned what we'd be going over in the presentation, so I won't repeat it all, but I do just kind of want to mention the statement that's at the bottom of the slide. The content shared in today's webinar is general information and should not necessarily be taken as personal medical advice. Just kind of wanted to mention that before we get started. So starting off with self-care, what really is self-care? If you've spent any amount of time online, social media, just the general internet, you've likely seen this phrase become increasingly popular. It's kind of become a sort of trendy topic to talk about. And at its most basic definition, self-care can be defined as actions that an individual takes in order to reach optimal health. There are 5 different types of self-care that all work together, including physical, social, mental, emotional, and spiritual. We will be discussing the physical, mental, and emotional aspects more in depth as they relate to nutrition and exercise. But before we go to the next slide, I do want to point out, so the pictures that are on this slide, I chose them for a reason. I want to point out a lot of these things are kind of what people think of when they think of self-care, kind of stereotyped activities, paying for a fancy massage, doing yoga, deep breathing, or meditating, or maybe unwinding after a hard day with a glass of wine and listening to music. And while all of those things can absolutely be done for self-care, nothing's wrong with that, especially if your budget allows for it, self-care does not always look like it does in these pictures. Self-care can sometimes be making sure that you don't miss your weekly church meetings, even though you'd rather stay home and relax. For your spiritual care or to recharge your social battery, maybe canceling plans you've previously made with friends. But yeah, just wanted to draw attention to those pictures. Self-care can be very different for each person, and it can also be completely free. Doesn't have to cost a thing. So why is it important? It's important for many reasons. Like the definition mentioned on the previous slide, it's things a person does to reach and maintain optimal health. But for the purpose of this webinar and the fact that I am speaking to healthcare workers during a global pandemic, I want to talk about burnout and how self-care can help prevent or improve the symptoms of burnout. I'm sure most of us have heard the phrase before. I know that I personally had a whole class on burnout in grad school, but for those that aren't as familiar, burnout is a work-related stress syndrome resulting from chronic exposure to job stress. When a person experiences burnout, they can face both personal and professional risks. Some of the professional risks could be lower patient or client satisfaction, lower quality of care, even potentially making medical errors resulting in malpractice suits, which always come at a high cost to both the employer and the employee. And some of the professional risks associated with burnout could be social withdrawal, negative impact on relationships with friends or family or even coworkers, drug or alcohol misuse, and in some severe cases, even things like suicide. So burnout. Burnout as a phenomenon was actually introduced in the early 1970s by a psychoanalyst by the name of Freudenberger, not to be confused with Freud. Burnout was originally viewed as a 12-step model, but has since been simplified to the 5-stage model that you see in the image. We will get more into each of the stages and the symptoms associated with each stage in the next couple slides, but I also want to point out that burnout consists of 3 different dimensions, which are emotional exhaustion, cynicism and depersonalization, and reduced professional efficacy and personal accomplishment. Burnout was originally viewed as something that was experienced only by healthcare providers when the phenomenon was originally kind of identified in the early 70s. But we now know, of course, that anyone can experience it. But I will point out that incidences of burnout are highest among physicians and other professions involving interactions with people, such as nurses, social workers, and teachers, just to, of course, name a few. So now we'll get down into each of the stage and break down the symptoms associated most often with each. The first stage, of course, would be the honeymoon phase. This is where people tend to feel the most valued by their employer, tend to have the highest job satisfaction rates. People in this phase will typically have higher productivity rates, higher energy levels, and overall optimism associated with their job. People in this phase are often the ones that usually accept higher responsibilities at work, more roles to take on, and they really just feel a high level of commitment to their jobs. Stage 2 would be the onset of stress. This is when things kind of start to take a turn and people will experience an increase in their irritability and a decrease in their ability to focus. The stress could potentially impact their sleep, and also in turn the quality of the sleep will also suffer. Productivity at work may drop as well and cause some people to avoid work-related responsibilities just altogether. Some additional symptoms such as change in appetite, lack of social interactions, and neglect of personal needs can be present as well. Stage 3 is chronic stress, and some of the associated symptoms are procrastination, exhaustion, potentially feeling threatened or pressured in the workplace, and a person can become resentful or honestly even aggressive, in some cases. This is also the stage that people will sometimes start to turn to alcohol or other substances to self-medicate or escape the other symptoms that they're experiencing. Stage 4 is the burnout stage. At this stage, people often become obsessed with their problems, and their likely kind of already pessimistic attitudes kind of can worsen significantly. This is also when people will experience more physical symptoms like headaches and even some gastrointestinal problems as well. Stage 4 is also where people may turn to escapist activities, such as denying that there's a problem or avoiding the reality of the burnout symptoms that they are experiencing. This is often done with intention to improve the problems, but of course, we know it only worsens things like anxiety and, of course, the other symptoms that they are experiencing as well. Stage 5, is habitual burnout. A lot of the symptoms in this stage are the same as like 3 and 4, but they become a lot more chronic in nature. This is also the stage where the symptoms could result in clinical intervention, such as medication trials or talk therapy. Kind of continuing on the subject of burnout, what causes it? Burnout can be caused by either internal or external factors, and oftentimes it is the combination of both. Some of the external factors could be contradictory instructions from those in leadership positions at your job, poor internal communication, poor work organization or teamwork, lack of feedback, lack of clarity regarding what you're supposed to even be doing at work. Some of the external factors that we have seen or heard about more recently and frequently over the last 2 years would be things like lack of resources like PPE, increasing responsibilities at work, and an increase in work hours, especially for mandated workers like nurses. And then some of the internal factors could be high self-expectation or perfectionism, always wanting, to please other people, having a strong need for recognition. And some of these factors could cause a person to suppress their own needs, really only worsening their chances of experiencing burnout. Some people may also view their work as the only meaningful activity in their day, or kind of use work as a substitute for a social life outside of work, which in and of themselves, those last two reasons are two reasons why it's really important for people to find things that we do enjoy outside of work to really bring us happiness. Moving on to talk about burnout and COVID-19. I know most, if not all of us, are burnt out from talking or hearing about COVID on a daily basis, but I do want to talk about it. There's a survey called the Coping with COVID Survey that was done May 28th to October 1st of 2020. There were slightly over 20,000 healthcare workers from 42 different organizations that took part in the survey, and a SSS, or stress summary score, incorporated fear of exposure or transmission, anxiety and or depression, and workload. Some of the main takeaways from the survey are the numbers that you see on the slide, with 61% of workers reporting fear related to exposure or transmission of COVID-19, 38% reporting anxiety and or depression, and 43% of those who responded reported feeling work overload, and just about half, 49%, reporting burnout. I do want to mention that this study, like I said, is from 2020, and I would think the numbers would be drastically different if the study incorporated 2021 and the first few months of 2022, but I know that there's currently studies going on where this information is being gathered, I think, to update these statistics. Continuing to talk about the survey, the survey found that the stress score was the highest among nursing assistants, medical assistants, social workers, and inpatient workers, which includes nursing assistants, nurses, respiratory therapists, nursing assistants and housekeepers. Another notable finding was that the odds of burnout were 40% lower in those who reported that they felt valued by their organization, which unfortunately for those that responded only made up about 46%, less than half of the people felt that way. The survey also showed that the stress scores were higher among women and Black and Latinx healthcare workers, which we're going to look a little bit deeper into. So the burnout inequities, the gender inequity. Overall, women had higher stress scores, with the burnout rate being just about half compared to male health workers at 41.5%. Fear of exposure or transmission was also high among women, with 61.2% compared to 54% of males. Feelings of anxiety and depression were 39.3% versus 26.4% for their male counterparts, and workload stress was 42.2% compared to 37.7% for men. And lastly, one of the statistics that I found was overall women feeling valued by their employer was 45.9% compared to men at over half, 55.5%. The racial inequity that was in this study showed that Black and Latinx workers had overall higher stress scores in general, and also that they had higher scores related specifically to fear of exposure or transmission, with 70.1% of Black healthcare workers and 74.7% of Latinx workers compared to 56% of their white healthcare worker counterparts. The survey also showed that the higher stress score roles that I had previously mentioned, most like nursing assistants, housekeepers, lab staff, medical assistants, those roles were held predominantly by either Black or Latinx individuals. So now that we know about burnout, the different phases and the associated symptoms, potential causes, how do we prevent it? Ultimately, the thing that's going to best prevent burnout is recognition of where you are kind of in those phases that we talked about and the coping strategies that you have to implement. Being aware of what burnout is and what it can look like and feel like will hopefully help a person catch it in an earlier phase, and then using the coping skills to intervene, of course, as needed. Burnout as a phenomenon and just kind of as a term has become more widely recognized, and there is an increase in overall awareness of this topic, which does make it easier to have access to helpful information and resources. There are also some different wellness strategies that can be applied to help cope with the various symptoms of burnout. The first being relationships. This means really understanding the importance of spending quality time with family and friends, partners, and really just an individual's support system. It's also important to note that work relationships can be really helpful as well to share experiences, because it's very likely that your coworkers understand on a very specific level kind of what your work-related stresses are, and that conversation is just going to be easier with them. But definitely, of course, wanting to note respecting your coworkers' boundaries as well. Another strategy that promotes wellness for some people is their religious or spiritual practice, which could act as a healthy coping strategy. Another element is a person's attitude towards work, including finding fulfillment and meaning in the work that a person does and the time spent there. For example, working part-time versus full-time, and really choosing to discontinue to pursue the unfulfilling aspects of that job. If possible, not everyone can go from full-time to part-time, I recognize that, but if you can, and you feel like you would benefit from it, recognizing that and taking the steps necessary. The fourth strategy focuses on life philosophy, meaning developing an approach to life that focuses on generally just having a positive outlook and identifying your own specific values, and creating a life kind of focusing on both of those with a balance between personal life and also professional life. And lastly, self-care practices, which we will of course talk about a couple of those coming up here, but overall, really it's one thing to say, oh yeah, I do self-care all the time, but really taking the time to become more aware of what your interests are and really specifically creating self-care practices that fit your needs, fit your schedule, fit what you're interested in. This, can also look like finally going to that therapy appointment that you've been putting off, or making the appointment with your doctor for the medical need that you've just kind of been letting go on for far too long. Another prevention of burnout could be psychotherapeutic interventions, which may be clinically indicated for the more severe cases of burnout that I referenced earlier. So the first form of self-care that I want to talk about is exercise, which would not only fulfill the physical wellness, but can also positively impact a person's mental, emotional, and in some cases, social wellness also. The CDC recommends that if a person wishes to maintain their current weight, what they should aim for is about 150 minutes of exercise a week, or break it down to 30 minutes a day for 5 days out of the week. Of note, this is a general recommended average. The exact amount of time varies significantly, of course, from person to person and what their needs are. If your focus is to lose weight, then the time and intensity would likely differ from the recommended average. Nutrition also would play a significant role in that as well. The types of exercises that are found to be the most effective would be a combination of both aerobic activity, like a rowing machine, hiking, jogging, even things like gardening could count as aerobic activity, and then strength training, or weightlifting. There's a lot of benefits to exercise. We've likely all learned about them at various times throughout our life, but one of the more commonly discussed benefits would be brain health, with immediate benefits being decreased feelings of stress or anxiety, and some long-term benefits being an improvement in your judgment skills and also general cognition as you age. Regular physical exercise can also be helpful for weight management, like we just mentioned. We gain weight, when it comes down to it, we gain weight when our calories in are higher than our calories out. So making sure to balance calories with output is really important for maintaining a healthy weight. Also, with regular exercise, you can reduce your health risk for certain illnesses, including cardiovascular disease, type 2 diabetes, certain cancers, and metabolic syndrome, which is a combination of conditions that can increase the risk of stroke, heart disease, and diabetes. Some additional benefits include bone and muscle strength. As we age, it's critical to take care of our muscles, joints, and bones, of course, so they can best support us and keep us moving. This can also reduce your risk of falls and overall just physical mobility. As we age, we lose bone density, but engaging in regular muscle and bone strengthening activities, as well as aerobic exercises, can slow the loss of bone density, while also improving things like balance and just overall strength. All of these benefits of course, work together so that you can live a longer life. And also, it's fun. Finding an exercise routine that you genuinely enjoy not only brings all of the benefits that just mentioned, but it's also something to look forward to, and it will put you around people with similar interests, making it a social outlet as well. Another nice thing about exercise is that really anyone can do it, regardless of your age, your socioeconomic status, your gender, your ability level. Anyone benefits from exercise, and what does this mean in terms of self-care and the symptoms of burnout? One of the more common symptoms that we saw when facing burnout is feeling an increase in overall stress. And actually, regular exercise can reduce the negative effects of stress that you experience by imitating the effects of stress while exercising. For example, like fight or flight. Putting your body through this will actually help your body and its systems kind of learn to work together to get through the stress, which can help down the line and also, of course, outside of the gym. Exercise is also known, of course, to get your endorphins moving. Runner's high, the feel-good transmitters that are released during high-intensity aerobic activity. You don't have to run to experience runner's high, but you could do whatever activity you found enjoyable. This kind of also, like the picture, the group biking, getting together a group of friends, not only will that kind of fulfill the social wellness and the relationships that we talked about in the wellness strategy, but getting the runner's high and getting your body moving and endorphins moving as well. Nutrition. Nutrition is also a very important part of overall self-care, and it can improve not only your physical wellness, but it can also have an impact on your mental and emotional wellness also. I want to point out that when I talk about nutrition, I don't mean diets. Often the term nutrition is used to refer to diets, which diets typically are restrictive in nature. So I just want to make it very clear that I'm not speaking about diets or restricting your eating in any way. Nutrition means nourishment, and that is different for each person. So ultimately, if you're considering a different nutrition plan than what you normally do, I would really encourage you to speak to a licensed professional like a nutritionist or a dietitian. I mean, even your primary care could maybe recommend somebody to you, but really somebody that knows nutrition. But I do absolutely want to go over some nutrition basics as well. So One of the first and main things that everyone should really do when looking deeper into their nutrition is really first learn how to read nutrition labels. They're on everything that we eat, but some people don't really know how to navigate them, and then that's fine. They've actually changed very frequently over the years, but really familiarizing yourself with where to find the information about both macronutrients and micronutrients on a label will just make it easier to read and understand, especially when you're in the grocery store grabbing stuff. You'll know what you're looking for. Another important part of nutrition is the serving size. It's really important to learn what the appropriate serving size looks like for you, and so that way you can more easily recreate it, when you're cooking for yourself at home, or even if you're dining out, you'll know kind of what maybe to save for later for another meal. Variety of food is also really important. And like I mentioned, it's really good to learn about macronutrients like protein, carbs, and fat, and then also micronutrients, vitamins, magnesium, zinc, things like that. And then lastly, another basic of nutrition, kind of just a general rule of thumb, is to limit your intake of fat, sugar, and salt. And don't get me wrong, I know that our bodies need that, but with all things in moderation. Definitely keep in mind your output, meaning the exercise that you're putting in should really always be considered if you're thinking of adjusting your intake as well. Some other important things to consider when it comes to nutrition, aside from food labels, are time, environment, and balance. It's important to learn and listen to your hunger cues and eat when your body is telling you that you're hungry. I'm sure most, if not all of us, have experienced feeling hangry, and that is your body's doing exactly what it's supposed to do. It's telling you it's hungry and it needs to eat. Also, that means your body's working. It's processing and digesting food correctly, and we really need to listen to our hunger cues. I know a lot of people that work in healthcare feel like sometimes they're forced to eat lunch late, or God forbid, skip it entirely. And that oftentimes impacts their mood, their feeling towards their work, and kind of the tasks that they have to do later in the afternoon. And also potentially it can impact how they interact with people throughout their day, usually making them cranky and their interactions not as pleasant. So it's really, really important to eat when your body's telling you to eat. If your body is experiencing hunger cues, listen to it. Actually, too, in regards to time, taking the time to cook your meals is really helpful too. For some people, really cooking in and of itself is a form of self-care. Taking the time to plan the meals, cook them, it can be kind of calming or have like a meditative effect. It's also really helpful to plan your meals out if your schedule allows for it. I know that not everyone's does. That means it's really nice because no staring in the fridge at the end of the day when you're hungry, wondering what you're going to make for dinner. And also kind of in a nutritional sense, people tend to snack less throughout the day when their meals are just planned, their calories and everything are already accounted for. The environment where you eat is also really important. And this is where nutrition can kind of be impactful on your social wellness too. Sitting around a table, even getting lunch with your coworkers during the day outside of where you work, sitting at your desk, staring at your computer, it can just be a peaceful and connecting experience, even eating by yourself, but as long as you're not really in an environment where you're in front of something that is going to take your attention away from your food. It can be, like I said, it can be a connecting experience. I know we're all guilty of it, coming home, sitting down in the front of the TV with our smartphone in our hands, just kind of scarfing down our food. And I get it, sometimes with life, meals just have to be like that. But really taking the time to eat also helps you better digest the food that you're consuming. And the last thing about nutrition, before we kind of move on to habits, I want to mention balance in a couple different senses. Life is definitely meant to be lived, and eating nutritional food is very important, but also sometimes just as important as that really sweet thing or salty thing that you've been craving as well. I say this all the time, no singular food is unhealthy by itself, the same way no healthy food is right on its own too. If you ate broccoli for every meal for the rest of your life, you would not be getting balanced nutrition. Broccoli is healthy, but you need to eat other nutrients as well. And also too, if you balance out your meals, then you can work in foods that are higher in fat and sugar, and it just kind of works. The phrase "you are what you eat" definitely has some truth to it. And if you regularly put nutrient-dense foods into your body, then you will absolutely notice a difference in other aspects of your life. and making sure that you're getting the right nutrition, it can have a lasting and impactful effect on things that are considered really the building blocks of basic wellness, like mood and quality of sleep. You know, when we were going through the phases of burnout and the associated symptoms, we talked about different things like loss of sleep, poor quality of sleep, irritability, your mood, things even as significant as gastrointestinal issues, all of which can be directly impacted by your nutritional intake, the food that you're putting into your body. Kind of the last topic that I want to talk about is, but arguably kind of a more important piece of all of this, is actually creating new habits with some tips and just kind of some helpful information to consider when trying to make new habits part of your daily routine. A lot of people will start thinking about new habits or goals that they want to work towards, and they'll rely mostly, if not fully, on the motivation that they're having kind of in that moment. And unfortunately, motivation alone it's just not enough. Research shows that at least half of our daily actions are habitual, and changing them or creating new ones cannot be fully dependent on willpower. This is partly due to the fact that habits become unconscious behaviors versus things that are done out of willpower or specific intention. So trying to simply, you know, flip a switch, create all these new habits, it's not going to be enough. I also want to point out that the difference between goals and habits, goals, sometimes they're used interchangeably and they're very different things. Goals are the bigger picture. You know, for example, kind of on the topic of exercise and nutrition, if your goal is to become more healthy, but the habits you create are things like going for regular walks, putting your running shoes out. So when you get home from work, your shoes are right there. The association for the habit is right there. Waking up early to make yourself a nutritional breakfast. Those are the little habits that are going to help you reach your overall goal of living a healthier or more active lifestyle. So how can a person go about creating new and sustainable habits? One of the first things that I recommend is focusing on one habit at a time. Really, with anything in life, if you put way too much on your plate, one, if not multiple things are going to fall through the cracks. That's just kind of how it works. Narrow your expectations and try to focus on one habit at a time. The second suggestion would be to start small. You know, if your goal is to start eating more well-rounded meals, maybe start by familiarizing yourself with some of the vegetables or more nutrient-dense food alternatives that you're interested in incorporating versus, you know, going to Whole Foods Market and just kind of loading up your cart on all of these things that you may not know what they are, may not know how to cook, may not even know how to make appetizing. Start small with the things that you know. Can sound really silly and even kind of potentially daunting to think of starting that small, but by starting small with things that really barely take any time or effort, there is a higher chance that you will follow through with it simply because it's that easy to do. Another recommendation would be to be specific. If your goal, you know, is the same, to eat more nutritionally dense meals, how do you want to do that? Do you want to incorporate more vegetables? How do you think your daily, what do you think your daily intake is lacking? Again, I just want to say that if you do want to do a complete overhaul of your nutrition, if that's what you think it warrants, do that, but definitely make sure that you are just consulting with a professional to make sure you are getting all of the macro and micronutrients that your body needs. But the habit has to be specific. If you want to exercise more, what's the type of movement that you enjoy best? If it's walking, then make the specific habit that you want. That's what you want to work on, and go back to step 2 and kind of start small. Like I mentioned, maybe placing your running shoes out, your walking shoes out, putting a water bottle there ready and filled so you can just take it with you when you get home on your walk. The next thing would be to pick a trigger or an anchor. This is also kind of referred to sometimes as habit stacking, which really means adding a new habit to an already pre-existing habit, making the chances of regularly engaging in that new habit higher because you're doing it either before or after an already, you know, kind of unconscious established habit. An example I use often when describing habit stacking is, you know, if a person wants to start flossing more regularly before bed, you probably already likely brush your teeth before bed. So stacking that flossing on top of the anchor habit or the trigger habit, which is toothbrushing, it's just going to be more likely that you will follow through with that because the toothbrushing is already taking place. Another step that isn't completely necessary, habit stacking, but it just makes it easier to pick a habit to stack that you already have established. Another one, the next step that I would recommend is, kind of sounds silly, but pick a habit that you actually enjoy. You know, research shows that you're more likely to stick with a new habit if you enjoy it. If you genuinely hate exercising in a public gym, don't make your new habit, you know, I'm going to go to the gym 5 days a week. No, you're not. You don't like going to the gym. Pick a habit that you like to do instead. Explore other options. You know, if you hate fresh spinach, don't pack yourself, well, I'm going to eat more spinach. No, just eat vegetables that you like and the ones that you already enjoy. May sound a little obvious, but starting new habits can already be difficult enough, so it should at least be things that you enjoy. Life is hard enough. The next recommendation would be to replace bad habits with good ones. Sometimes our bad habits, like maybe mindlessly scrolling through social media, you know, once you sit down at the end of the day, I know that I am absolutely guilty of it, can actually be responses to triggers that we may not even be aware of. Once you identify your trigger for the habit that you wish to change, like the one I just mentioned, try substituting for a habit that's healthier. You know, instead, you know, when you go to sit down in the chair at the end of the day, which would be the trigger or the anchor habit, and you pull your phone out, that's okay. You want to relax with your phone in your hand, maybe do like a meditation app or a mindfulness app, or I don't know, there's word apps where you can learn like a new word of the day, but just something a little more healthier. Over time, of course, if you stick with it, you can completely replace the bad habit with the healthier one. It's also really important to track your progress if possible. This step wouldn't necessarily be easy to apply, of course, for every habit, but it is important to note. I'm sure most of us have smartphones or possibly like a physical calendar hanging up in your kitchen at home. Use those things, use those tools that you already have in your life. Put in your phone or on your calendar at home, you know, when you were successful in implementing the new habit. Can sound kind of weird maybe for like a habit like flossing. But it's important to track your progress. This is also kind of talked about how it's motivation alone really isn't enough. Things like discipline and consistency are really important. And this is kind of where those two factors can come into play. You know, if you're looking at your calendar and you did 3 straight weeks of your new exercise regimen, but you really want to skip the day that you normally go, you go back, you look at the calendar or your phone, you see all the days where you showed up for yourself, and hopefully, you know, kind of stick with that habit. Rest days are important. We're all human. I absolutely get it. But just tracking your progress can make it more motivating. And then last, but absolutely not least, treat yourself, reward yourself. Something that I'm a big fan of, you know, of course, if your budget allows for it, I'm not saying go to the mall and lose your mind, but creating and sticking with new habits, it's not easy, especially today, especially when you work in healthcare, you feel like you're being pulled in a million different directions and doing everything for everyone else except for yourself. So if you create new habits and you stick with them, reward yourself. The next slide is my sources. And then it's really the end of my presentation, but a few things that I do want to reiterate kind of before we move on to questions. When preventing burnout, it's really necessary to know yourself and where you fall in those 5 stages that we discussed, and intervening with healthy coping skills as soon as possible. Burnout is very real and can be very serious, sometimes resulting in people losing their jobs or doing something unintentionally to harm themselves or somebody else. So as we were kind of talking about those stages and those symptoms, if you feel like you identified with some of them or maybe multiple, talk to somebody in your family, talk to a trusted individual. And then when it comes to exercise, I cannot emphasize enough that literally any amount of exercise is better than none. And getting started with small steps is better than holding off and saying, next week I'll do it, next week I'll do it, because there's really no good time to start something like that. That kind of also goes for nutrition too. Nourishing your body is really the foundation of health. And we live in a world that can sometimes villainize food or make food out to be something that needs to be restricted to see the desired results. And that's not true at all. Healthy nutrition is really an investment in your life and in yourself. And that's exactly what self-care is. And I know as people that work in healthcare and have helper roles, we're always placing others' needs above ourselves, but just really knowing what could be the cost of that, it's really important to get started on stuff like this.
Well, thank you so much for providing this wonderful information. So now we are going to open it up to audience questions. Just a reminder that the audience will stay muted to avoid background noise, but you all can type your questions into the questions box at the right-hand side of the screen if viewing from a computer, or at the bottom of the screen if viewing from a phone. If you have a question that you'd like to ask, or if you have a comment about the webinar today, please enter these into the questions box now. If we don't have time to answer your question today, we will provide our contact information at the end of the webinar for anyone who may wish to reach us. And so now, Lauren, we actually do have some questions that people submitted at the time of registration. So the first question is, do you have any tips for integrating small steps within the actual workday or your shift?
Yeah, absolutely. Something that a few different things. One would be to schedule it in. I know if depending on your role, you may not be able to work with a schedule, but if that is possible, definitely scheduling it in. I know something that I do is I try to go on a walk after lunch. I eat lunch every day, and so if the weather allows for it, I try to do it just immediately following. Also helps digest food. Something else that I would recommend would be, and again, may not work for everybody, but kind of having a colleague hold you accountable. Somebody, just kind of getting somebody to do the habit with you. That way on days when you're maybe feeling like you're drowning in work or you just don't have time, they can sometimes kind of say, hey, let's go do this walk. We do this every day. Even if you're like, no, I can't. No, you do. You have time. Make time for yourself. So yeah, schedule it in. And if you can have like an accountability buddy, it also kind of makes it enjoyable too, because you can maybe vent or whatever else you need to do. But yeah, that would kind of be my suggestions.
Great, thank you. The next question is, how do you balance elder care and working from home with a husband who also needs attention? And so this is kind of like, in your personal life, you have these things, and how do you balance it all?
Yeah, which that's definitely a multi-layer question. I would think really, time management for one, and I guess, trying to schedule things in when you can. Something else that I'd recommend would really be communicating your needs. Obviously, if you have to care for an individual, maybe not communicating it to them, but to your support system, maybe a husband, hey, I had a really hard day. I need more time for myself. Definitely being open and honest with where you are so that the people around you, I would think, they're caring and want you to be doing well, but really being honest with where you are to other people so that they know how they can best support you. Also, so they're not putting, piling up more stress on top of you. And also, I was going to mention boundaries. That would probably be a whole other presentation. But yeah, if you need to set boundaries and stick with them, people just have to respect that. We have to take care of ourselves first.
Great, thank you. The next question is, does stress affect women over 60 differently than younger women? I notice my memory is lower. I feel less sharp at times.
Okay. Yes, the overall answer is yes. Stress definitely does affect people differently as they age. There's a few different factors in that. Really one of the best defenses for stress is getting a good night's sleep. And kind of as people age, typically their sleep is impacted. Either they're not just getting enough sleep or their sleep isn't as restful. A lot of times you have to wake up and use the restroom in the middle of the night. So just your quality of sleep as you age decreases, which can impact your stress. Another thing is that hormone levels, as you age, your body's ability to process them diminishes. And so when you get stressed and you have like a high cortisol level, your body isn't as quickly, it can't regulate that hormone as quickly and get it out of your system. So you're going to experience that stress a little bit differently. So yes, the answer is yes.
Hey, thanks. And a next question is, what's the connection between kind of blood pressure and diet and exercise?
Meaning like, well, a few different things. As you exercise and you get your blood pumping, your cardiovascular system is just working, it's operating. High blood pressure with food, I don't know if I'd be able to speak. I mean, obviously, like things that are high in fat and sugar and salt, just things that are not processed as easily through our bodies. Definitely, I don't have the background education in nutrition to speak as much to that. Yeah.
And what do you recommend women should do on a daily basis to release stress and build up their metabolism?
Metabolism, a few different things for, and this could really kind of even go for men or women, a few different things for metabolism. It's really good to eat. A lot of people think if they restrict their intake, then their body will burn more calories and increase their metabolism. It actually does the exact opposite. It kind of puts your body into like starvation mode, and it holds on to the calories that you are putting in, slowing your metabolism and sometimes causing you to gain weight. So definitely eat meals throughout the day. Listen to your hunger cues. Eat smaller meals because that will keep your metabolism going. Also exercising throughout the week. Exercise keeps your metabolism regular as well. Eating more protein dense meals versus things like fat and carbs. Our body uses more energy to really digest protein. Carbs, especially I can't think of the term, like more basic carbs are just, our body just burns right through them. But protein takes a little more energy to burn. Process called thermogenesis. And then also sleep definitely helps. Because that can impact your stress, which stress, very high stress levels can impact your metabolism. And then also, this is something that I've known since I was younger, but drinking water. If you drink cold water, your body, the same thermogenesis, that I just talked about, your body uses that same process to warm the water to make it be able to be absorbed into your body. So if you really drink cold water, that can help your metabolism as well.
That's really cool. I didn't know that. And another question is, for someone who only thinks about exercise and eating nutritiously when in good mental health, what do you recommend? So I guess this person's asking, I'm already kind of have good habits. Is there something that could like take them to the next level kind of thing? I think is the question.
I mean, it depends on what your habits are. I definitely think you said they have good habits, but want to know, can you repeat the question? I'm sorry.
For someone who only thinks about exercise and eating nutritiously when in good mental health, what do you recommend?
Okay, so you really only focus on your exercise and nutrition when you're feeling good. So maybe when you're not feeling good, they kind of lag, is kind of how I read that or hear that. That I think is going to be more where the habits come into play, because habits, like I said, are kind of more unconscious behaviors that we just do. I actually just read something the other day. It's like the majority, it's like the overwhelming percent of the actions we take during the day, like 90% are unconscious habits, whether through work or just family interactions. So really putting, I guess, trying to work when you are feeling well, to kind of create those habits and start a plan so that which I guess you'd be using the motivation at that point, but then once the habits are established, kind of when you're not feeling as well, using the discipline and the consistency, using the tools like tracking your progress. But yeah, I would think to really focus on implementing new habits when you are feeling well, so that when you're not, those habits are just, they're already established.
Great. And I have a question. If someone finds themselves at the habitual burnout part of the spectrum, like they've kind of gotten to that like last phase, how can they pull themselves back?
Yeah. One thing I would definitely say is to talk to somebody at your employment, whether it's if it's trusted, like a supervisor role. If not, definitely go to HR. You know, using things like PTO that you can use at work, but definitely communicating where you are and reaching out, you know, to a licensed provider, whether it's a therapist. A lot of places in Maryland, I know there's one in Harford County. I know there's one in Baltimore City, but if it's like a crisis response intervention type of thing, but definitely if you're at like the stage 5 where things are more chronic and more serious, I would absolutely reach out to a licensed professional. And even too, I mean, I know like there's like Talkspace and different apps on your phone that you can use. But if you're at that stage, definitely reaching out to somebody like a licensed professional. and your employer. Sorry.
And you just talked about like apps and tools. Do you have any good apps for self-care or websites that people might be interested in looking up?
So there's actually a book that I kind of recommend. I obviously have no like vest in it. It's called Atomic Habits. I can't think of who the author is. It's something that I've read a couple times and I absolutely love the book. That's where I've gotten a lot of like my habit tips and stuff like that. That's a really good read for just breaking down habits and the habit stacking and things like that. As far as self-care, I mean, it just differs so much for everybody. I know that a lot of people, if they're looking, exercise can be kind of intimidating. You know, you walk into a commercial gym and it's people grunting and sweatiness, and it can be really intimidating. So I really encourage people, if they're not super comfortable with things like that, kind of creating a plan before they go into the gym. There's all different kinds of apps. I personally use one that creates my exercise routine for me, just kind of takes the stress out of it. I don't have to think about it. Some are free, some cost money. I know there's a few. There's one called Center, CENTR, creates a meal plan for you, creates your grocery list for you, and it's fairly reasonably priced. I think it's less than $20 a month, and that way just kind of all like the meal planning, the time, all of that stuff that we kind of talked about, you can pay them to do it for you. But yeah, I mean, there's a lot. I mean, a lot of them cost money, unfortunately. But I mean, even using Google and kind of trying to create exercises for yourself, writing it down on a piece of paper or putting it in your phone, that way you kind of go into things with a plan. That way you won't feel as intimidated.
Great. And someone from the audience says that James Clear is the author of Atomic Habits, for
Yes.
people that are curious about that. And I have, one last question, unless we have more questions from the audience. Say you're a supervisor and you notice that your employee might be experiencing burnout. How do you approach that person? How do you start the conversation?
That's a good question. I don't know. I mean, I guess it would depend, because obviously you want to respect boundaries and professional boundaries. So I guess it depends on kind of what your relationship is like. And I know, like, I personally, as a social worker, have supervision, and I have a relationship with my supervisor where if she did, I would welcome that. You know, I could talk about that. I guess maybe generally identifying, the last 2 years with COVID, but even outside of COVID, healthcare is a stressful job. You're constantly giving to other people, and you can't pour from an empty cup. So maybe vaguely referencing, hey, I know things are really hard. I just want to reiterate to you, if you ever need to talk to me about certain things, whether it's your work schedule, your responsibilities, I guess kind of neutrally opening it up, giving them the information that, hey, I'm here if you need me. But yeah, I don't know if there would be, with respect to boundaries, of course, too. Yeah, I guess that would be my suggestion.
Great. Thank you so much. And thank you for being with us today. I know we have some closing remarks. Marquis, if you want to get us started there.
All right. Okay, so thank you everyone for joining us this afternoon, and thank you again to Lauren and Gia for volunteering your time this afternoon for this very useful discussion. As a reminder, this webinar has been recorded and will be emailed to registrants tomorrow. The webinar will also be uploaded to our website at www.namimd.org for any individuals who are unable to register for the webinar today. We hope that this webinar has been helpful for you this afternoon. At the end of the webinar today, you'll be asked to complete a short survey on the aspects of this webinar that you felt were helpful, could be improved, and what would you like to see in future webinars. We plan to continue hosting educational webinars, and this survey will help determine how NAMI Maryland can best support you during this time. NAMI has partnered with BetterHelp to support our local healthcare workers for providing access to a free month of therapy. BetterHelp is convenient, private, online therapy where you can talk to a licensed professional therapist at any time. If you are a healthcare worker, including mental health and/or substance use provider, be sure to fill out the post-webinar feedback form to receive instructions and your discount code. And then also, don't forget, we can only offer these webinars free of charge because of the dedicated support of individuals and organizations like yours. While we already knew that 1 in 3 adults reported experiencing symptoms of anxiety or depression, a new study found that 52% of adults have been more open with others about their mental health since the pandemic started. This rising need means we need your help now more than ever. and we invite you to join us for our 2022 NAMI Walks Your Way Maryland campaign. NAMI Walks is a several months long campaign that promotes public awareness of mental health, reduces stigma, and supports our mission of recovery focused support, education, and advocacy for individuals and loved ones affected by mental health conditions. This campaign will build on last year's success, and we will continue to explore and expand on the positive ways the arts impact mental health. We're excited to share that this year will be a hybrid of virtual and private in-person events that will begin in early spring and will include a virtual art showcase on Saturday, May 21st, 2022, and an in-person invite-only VIP wrap-up party on Saturday, July 9th, 2022. The first NAMI Walks took place in Maryland 20 years ago, and we invite you to celebrate this milestone with us as a participant for this incredible campaign. You can learn more about NAMI Walks and register for free at www.namiwalks.org/Maryland. We wish you all a safe and healthy rest of your week, and please do not hesitate to reach out to us through our website or by phone at 410-884-8691 should you need additional resources or support. Have a great rest of your day.